Good morning, everyone. My name is KARLA SHARON Bautista. I'm a second-year internal medicine resident in Hospital Ángeles del Pedregal in Mexico City. I'm the author of this case report called Functional Neurological Disorder, a case report. The co-authors are DANIELA, CABRERA, PALOS, also second-year internal medicine resident in Hospital Ángeles del Pedregal in Mexico City, with gratitude towards Dr. ENRIQUE Juan Díaz GREENE and Dr. FEDERICO Leopoldo Rodríguez Weber for the valuable guidance through this project. The background of this work is based in 3 key points. 1. Functional neurological disorder is a disease with symptoms or deficits that affect voluntary or sensory motor functions, which suggest another medical condition. 2. It can be caused by psychological factors, since the disease is preceded by conflicts or other stressors. 3. The deficits are not produced intentionally, are not caused by substance use, are not limited to pain or sexual symptoms, and the gain is primarily psychological and not social, monetary, or legal. We present a classical example of an habitual longitudinal evolution of this disorder. Thus, the main objective of this work relates to the importance of the clinical management and outcomes that commonly are confused with other pathologies, delaying its diagnosis. This disorder, when properly treated, can significantly improve the quality of life of the patient. This case is about a 47-year-old female patient with a history of type 2 diabetes and dysautonomia under treatment, who come due to an hour-long loss of alertness, which upon recovery present disorientation in time and place, dysphonia, blardyglalia, bradypsychia, dyscalculia, dysgraphia, variability in the strength of the forelimbs, and the presence of astasia-abasia gait. Therefore, the study protocol is centered, where after adequate medical history, physical examination, and complementary studies, the diagnosis is reached. An MRI of the brain is requested, which is reported as normal, an electroencephalogram that is reported without epileptic activity, and a lumbar puncture is performed where no alterations are shown. After evaluating the case, it was decided to consult a psychiatrist, who, after requestioning the patient and relatives, reported that the episodes of syncope that she had presented were always preceded by some family discussion or some other kind of psychological stressor, which began approximately when the patient reached 30 years of age, and has continually presented for 5 weeks anhedonia, depressed mood, 3 kilograms, weight loss, hypersomnia, psychomotor retardation, and recurrent thoughts of death, for which the diagnosis of major depressive disorder and functional neurological disorder are integrated. Medical treatment and behavioral therapy are started. As a conclusion, a clinical case of functional neurological disorder is presented, which was diagnosed through a complete medical history and physical examination, finding characteristic findings of this pathology and ruling out other pathologies. The patient received an adequate psychological intervention for major depressive disorder, however, not for functional neurological disorder, which according to the most relevant clinical practice guidelines, recommend the use of psychodynamic therapy. This is an underdiagnosed condition in the hospital environment by a specialist in areas of internal medicine. This is a problem since this disorder often presents with other chronic or non-transmissible comorbidities, and if not detected, it may have an important clinical outcomes in the integral management of the patient. Therefore, the medical population that is dedicated to these areas is reminded to take a basic training for identification of frequent psychopathologies.